Haiti is a nation that has been affected by global health problems and disease for decades. We have been asked to make this video just towards the head of the Ministry of Health to ask for help in addressing some of the major issues that affect Haiti. The 2010's earthquake had a hugely detrimental effect on the country. However, Haiti's situation has improved dramatically since then. Despite this, the nation is still largely suffering from its effects.
Communicable diseases continue to be one of the largest causes of death for all age groups in Haiti. Overall, ischemic heart disease and stroke are two of the leading causes of death. However, the most deadly diseases besides those are almost entirely communicable. For example, over 5% of the population dies due to HIV or AIDS. Similarly, close to 5% of the population also dies due to lower respiratory infections or diarrheal diseases.
The three main public health problems which we are going to address include cardiovascular disease, lower respiratory infection, and HIV and AIDS. Findings show that cardiovascular disease such as ischemic heart disease is the leading cause of death in Haiti, accounting for close to 40% of all deaths in 2016. The rate of cardiovascular disease is high due to the high rate of pollution in the country. However, this pollution is not from industry, like in countries such as China, but from residential and commercial infrastructure, which make use of diesel generators which release a lot of pollution into the air. Similarly, much of the population does not have access to a balanced diet, causing deficiencies in certain nutrients, which may increase the risk of cardiovascular disease. Haiti has also one of the highest rates of HIV or AIDS in the Western Hemisphere. This high rate of HIV and AIDS stems from the nation's high poverty rate, leading to a lack of proper medical care and access to contraception. Similarly, the nation's low literacy rate leads to a lack of sexual education. Lower respiratory infections also stem from the uncontrolled pollution in Haiti, affecting those who live in the city centers and urban areas the most. Additionally, the high rate of tobacco use only worsens these numbers.
According to the World Health Organization, recommendations for cardiovascular disease prevention include maintaining a healthy diet, engaging in regular physical activity, avoiding tobacco use, keeping a close eye on blood pressure and blood sugar levels, and limiting the consumption of alcohol. For lower respiratory infection prevention, the recommendations are reducing the indoor air pollution, improving access to hospital care, increasing accessibility to vaccines, improving socioeconomic and hygiene conditions, and decreasing smoking rates. For preventing HIV and AIDS spread, the recommendations include male and female condom use, regular testing for sexually transmitted infections, taking medication, using clean needles and syringes, and male circumcision.
Cardiovascular disease primarily affects the older generations. Thus, they are known to be a vulnerable population for the disease. The action plan states that individuals with a healthy diet and who exercise regularly will decrease their chances of cardiovascular disease. Therefore, individuals who do not stick to a healthy diet and regular physical activity are prone to cardiovascular disease. Furthermore, people who abuse alcohol, tobacco products, and have prior family history of high blood pressure are also at risk of cardiovascular disease.
Lower respiratory infections can affect individuals of all ages, but it is particularly evident in older individuals, as well as individuals who smoke on a regular basis are also more prone to lower respiratory infections. This includes people who are in the same household as regular smokers, as secondhand smoke has similar effects on health. In addition, people who do not live in urban areas and those who have limited access to vaccines and hospital care are more at risk of infection and later succumbing to the disease. Another population who are particularly at risk are people who live or work in areas of poor air quality, ventilation, and circulation.
HIV and AIDS run a higher risk among the younger generation as they are less educated than their older counterparts. As well as being more sexually active, their accessibility to contraceptives such as condoms are quite low due to their financial situation. Moreover, injection drug users are more likely to become infected with HIV and AIDS as they are the populations that are frequently in contact with unsanitary needles for intravenous injection. Another vulnerable population are sex workers, since they have more sexual encounters with strangers without knowing their partner's sexual history. Furthermore, Another vulnerable population are people who do not get tested regularly or at all, as they may be unaware of any sexually transmitted infections that they have or may be knowingly spreading them to others.
We, the Group 2 Working Group, have identified 3 key areas of focus as outlined in this strategy. We recognize that the resources of Haitian Ministry of Health is limited, and have further targeted certain demographics to improve the efficacy of our strategy. To end this video, we put forth a call for action from the international community. For the strategy to be a success, we require continued support from NGOs and governments whose expertise and resources can fully implement this strategy. While no country can be completely healthy, our health strategy report would better the lives of all Haitians, uplifting a population from the burden of the most serious diseases into forefront of modern development.